So we are going to discuss important triads over here. Uh, Please note down each and every point because every year or alternate year you will get one or two questions from these triads. Okay. So first one which I have already discussed, that Fitzgerald's triad. Fitzgerald's triad is related with thrombosis or intravascular coagulation. Fitzgerald's triad. For intravascular coagulation, you all know that you need endothelial injury, and because of this endothelial injury, because of the endothelial, there will be some sort of change in the circulation. So there will be stasis, endothelial injury plus stasis, or change in circulation plus you will get both these two are not sufficient to make blood clot in the intravascular structures, like okay, you need hypercoagulability. So hypercoagulability. Second one. So second one is I have told you the of triad of syphilis, congenital syphilis. Name of the triad is Hutchinson triad. Hutchinson's triad. Hutchinson's triad is related with congenital syphilis. It is related with congenital syphilis, and triads are like that. Uh, you will get Hutchinson teeth, like upper incisors are carved upward. Hutchinson teeth. Hutchinson's teeth plus interstitial keratitis plus deafness, and this deafness is sensory neural deafness, not this conductive deafness. Okay, sensory neural deafness. Important. Third one. In nasopharyngeal cancer generally arises from a space that is known as fossa of Rosenmuller. Fossa of Rosenmuller. Rosenmuller is the space from where the nasopharyngeal cancer arises. In nasopharyngeal cancer, you will get a triad. Name of the triad is Totter's triad. Totter's triad. What is that? In nasopharyngeal cancer, there will be conductive hearing loss. Plus, patient will have trigeminal neuralgia. And patient will have uh, ipsilateral, or you can say that homolateral soft palate, that will be immobile. So plus mobility of homolateral soft palate. These three consist Totter's triad. Next, very importantly, you will get Whipple's triad. In Whipple's triad, you will get it in insulinoma. In insulinomas are the tumors which secrete insulin, specifically insulin. And if there is any tumor which is secreting insulin, what will be the blood glucose level in the blood? That will be decreased. Okay, so in insulinoma, you will get Whipple's triad. Obviously, in insulinoma, you will get a decrease in the blood glucose level. So you will get symptoms of hypoglycemia. You will get symptoms of hypoglycemia. you will get serum glucose level, it will be decreased. Glucose level, it will be decreased to less than 45 mg per dl. Important. And if you administer glucose or if you administer IV dextrose, then what will happen? The symptoms will be improved. The clinical condition will be improved. So you will get improvement of the status, improvement of the symptoms after administration of glucose. That may be oral, that may be uh, in, you can infuse it intravenously. Glucose or dextrose. Uh, Suppose a patient of chronic alcoholic patient is having severe retching and patient is vomiting blood. That is vomiting blood. If the amount is very small, that means the tear is in the esophagus, in the lower esophagus, and it is mucosal tear. It is not that much deep. If patient is having tear of the esophagus, tear of the esophagus through and through, all the layers of the esophagus are being torn, then that condition is known as Borham syndrome. So the superficial tear, you will know that that is known as Mallory-Weiss tear, and Mallory-Weiss syndrome is different. Mallory-Weiss syndrome is very superficial tear. You will get vomiting after retching, and the patient is typically alcoholic. In both the cases, patient is alcoholic patient. But if the tear is, it is involving the entire layer of the esophagus, then that is known as Borham syndrome. Syndrome. Tear, I will take esophageal tear. Uh, it is entire esophageal tear, complete esophageal tear, and this is very dangerous condition. So patient will complain of thoracic pain. Patient will complain of vomiting, and patient will complain of cervical. You will get cervical subcutaneous emphysema. Emphysema. Okay, then fourth one, just write it down. Galegia triad, very important. Galegia triad. Uh, Galegia triad, you will get Dupuytren contracture. Dupuytren contracture is it is palmar fibromatosis. Okay, uh, contracture. Dupuytren contracture means there is palmar fascia. Suppose this is the palmar fascia, and you will get fibrous tissue formation in the palmar fascia, and that will lead to contracture of the finger. Basically, most commonly the finger which is affected is the ring finger. Ring finger is the most commonly affected in Dupuytren contracture. This is known as palmar fibromatosis. Palmar fibromatosis. Okay, and so in Galegia triad you will get Dupuytren contracture plus you will get retroperitoneal fibrosis, and third one is you will get Peyronie's disease. Peyronie's disease or Peyronie's disease, whatever you spell. Okay, Peyronie's disease. Peyronie's disease, it is basically the contracture of the penis. Contracture of penis. These three consist Galegia triad. Okay, next. Okay, I have told you that thoracic pain, vomiting, cervical complaint. This is known as Mackler's triad. Triad. Okay, what is unhappy triad? Unhappy triad of O Tongi. Just write it down. It is known as unhappy triad. Related with orthopedics, but still it is very important. Unhappy triad of so or it is known as unhappy triad of blown knee. So injury, if there is injury to ACL, anterior cruciate ligament, then medial collateral ligament, MCL, medial collateral ligament, anterior cruciate ligament, and medial collateral ligament, and patient will have injury to the meniscus, any of the meniscus, that may be lateral or medial meniscus, that consists unhappy triad of Podoldi. Then come to Cushing triad. Cushing triad, important. Cushing triad you will get if there is increase in intracranial tension. So if there is rise in intracranial tension, what will happen? Uh, you will get what will the pulse? Pulse will be, there will be bradycardia. Na? So if patient is having bradycardia, patient is having increase BP, okay, and patient is having decrease in respiratory rate. So patient will have bradycardia, patient will have bradypnea, and patient will have hypertension. That consists Cushing triad. Important. Okay. Now come to another very important triad that is known as Rigler's triad. Just write it down. Rigler's triad. It is found in gallstone ileus. Rigler's triad. Rigler's triad. You will get it in gallstone ileus. Here you will get a small bowel obstruction, plus patient will have pneumobilia, and patient will have ectopic gallstone. Details will be dealt in your surgery respective surgery class. Just for now, remember these triads. Talufoi triad. DIEU. DIEU. Talufoi triad. You will get this triad in cases of acute appendicitis. So, what will be the three important component? First one is you will get hyperesthesia of the skin. Hyperesthesia of skin. You will get tenderness. Tenderness in the obviously in the right iliac portion. And third one is you will get guarding over the McBurney's point. Big triad, important in important triad of cardiology portion. Big triad, big triad. You'll know that if there is pericardial effusion or if there is cardiac tamponade, then what will happen? Mm, if there is fluid accumulation in the pericardial space in cardiac tamponade, what will happen? There will be, if you put stethoscope here, you will not get heart sound very clearly. So you will get muffled heart sound. Muffled heart sound. Obviously, the venous return itself, it is uh, the venous returns to SVC, it is hampered, decreased venous return. So what will happen? You will get engorged neck vein, engorged neck vein, and you will know that if there is if there is pericardial tamponade, the heart action it itself very labored. It is hampered. So what will happen? You will get decrease in the cardiac output. So you will get hypotension. Hypotension is a feature. So these three uh, consist the big strat. Uh, if a patient of a road traffic accident or if any kind of chest injury, they complains these three, there you are getting these three signs, then you can easily diagnose the condition as cardiac tamponade. Important. There are so many triad, like Cartagena syndrome triad we have already discussed. Another important triad is ladies syndrome triad. Just write it down. Syndrome triad. What is that? So in ladies syndrome, what happens? There is a there is a obstruction to the aortoiliac junction. Aortoiliac junction. So you will get bilateral hip, thigh, and buttock claudication. And you will get the obstruction in the aorta and the common iliac artery. Buttock. Bilateral hip, thigh, buttock claudication. Patient will complain of impotence. Impotency. Okay. And patient will have symmetrical atrophy of the lower extremity due to what? Due to chronic ischemia. Plus patient will have symmetrical atrophy of the lower extremity due to chronic ischemia. Okay, thank you so much.